More especially chicken breast. Your mouth smells very badly. Okay? So the correct thing to do is to brush your teeth after every meal. So if you eat 3 times a day, you need to brush your teeth after every meal. And then some of you ladies don't brush your teeth when you go to bed. Hi. You don't brush your teeth when you go to bed. Your mouth will be stinking, or you don't floss. Do you know what is to floss? Okay? You know we use toothpicks, but we must floss also every day. Okay? Yes. And then, how many times do you shave your armpits and your private area? Okay, let's say per month, how many times do you shave? Okay, I hear it depends. I hear it depends. Okay, fine, I take that. It depends. But at least you must shave your armpits and your vaginal area at least once in 2 weeks. There must be no hair in your armpits. There must be no hair on your vagina. So you must shave at least once in 2 weeks. Okay. I'm going to ask you this. Have you ever seen that after bathing, try to put your finger between your butt cheeks and smell it? After bathing, have you ever smelled that smell? Do you know why that smell is there? Do you know there's hair between your buttocks? And that hair must be shaved off as well. You must use hair remover. Okay? So you must, if you talk to the men, they will tell you that my wife smells. That's why I'm not comfortable doing certain sex positions, because there's that smell at the back. So whenever you shave your armpits, your vagina, don't forget that you need to put a little bit of hair removal between your butt cheeks. That hair needs to come out, okay? Okay. Just the fourth thing before we get into my main presentation. What kind of meals do you eat at night? As a lady, as a woman, what kind of a meal should you eat? Okay, yeah, I want one person at least to own up with an answer. Whatever the family is eating. Okay, whatever the husband is eating or the children. Okay. So let me help you, ladies. You know, as a woman, right? Don't eat heavy meals at night. Don't eat heavy meals for dinner. Don't eat lots of pap and lots of, you know, when you just go to sleep, you'll just be farting the whole night. You release gas the whole night. I promise you. If you eat, yes, don't eat heavy meals at night. Okay? You eat light meals at night. You rather have a heavy meal in the afternoon, but at night, try to eat a light meal. Okay? If I can go to the married ones, it's even worse. You are farting the whole night. You are bloated the whole night. You rather eat your meal at least around 3 hours before bedtime, and then later then on, try to have a fruit, pineapple, orange, nachos, according to what you can afford. You understand? So it's not a one size fits all, but we will get to what I was talking about. I don't know if my presentation is ready. Is my presentation ready? If it's not yet ready, this one is directed to the married women. When do you go to the toilet after sex? When do you go to the toilet after sex? Okay, that's the correct answer. Immediately, okay? Immediately. And you'll see why I'm saying immediately. Because I'll get to my presentation and I'll explain to you why we say immediately. After you have the act, you must go to the bathroom, you must pee, okay? And you must wipe yourself with a wet towel before a dry towel, all right? Okay. I can go to the next pointer while they're still putting up the presentation. I'm going to ask this. What do you use to bath inside your vagina? Plain water, that's good. People are using soap inside your vagina. That's wrong, okay? You only use soap outside your private parts. Inside, you only use water. You don't even use bath salts. You don't use anything. Because once you start using soap, bath salts, these days they call this Femi wash. Let me tell you, those things are only going to make you a breeding ground for infections, okay? So you use water inside. I don't care what they are advertising on the TV, but let me tell you, from a medical perspective, you only use water inside your vagina. Outside is where you can use soap, okay? All right. And then I often hear these things when women come to the clinics or to the hospital. They say, I want tablets to clean my system. What do you want to clean? What do you want to clean? Is there anyone who wants to answer me? Yes, tell me. Okay, so at least now this brings us to my presentation. Because now we need to know what is a normal discharge. What do you do when your discharge becomes this color, and that color? Okay, right? So that thing of saying I want to clean, I'll teach you the right things today. There's nothing like cleaning for women, okay? Everything is fine as it is. We just need to know how to take care of our female reproductive system, okay? Let's go to slide number 2. So like I was asking, like what is the normal discharge? How is it supposed to look like? Okay, so a normal discharge is supposed to be, number 1, odorless. It's not supposed to smell bad, right? Number 2, it's supposed to be, if it's going to be whitish or colorless, it's supposed to be slimy, okay? That's what a normal discharge is. So it's either white, slimy, white or colorless, but it's supposed to be slimy, and it's not supposed to smell bad. So anything other than that, the discharge is abnormal, and you need to seek help. I'll give you some of the tips, the things that you can do just going to the pharmacy before even going to the hospital. So what is an abnormal discharge? An abnormal discharge, obviously, it smells bad, okay? It's any other color that is besides your white and colorless. So it can be green, it can be gray, it can be watery, it can even be brown. You see, it can even be yellow, right? So I have a next slide picture just to show you what is normal. Obviously, clear is normal. Whitish, if it's slimy, it's normal. If it's gray, it's not normal. If it's yellow, it's not normal. If it's green, it's not normal. If it's pink, sometimes you're starting your period, or sometimes you are implanting and you are pregnant. If it's red, we obviously know that this is blood. If it's brownish, sometimes it's an infection, but sometimes you're also concluding your periods, okay? So I just need us to be on the same page, which shows me the next diagram. All right. So I need everyone to understand that there is 3 systems that are taking place in a woman's abdomen. Okay, so this is not a stomach. This is an abdomen, okay? Your stomach is right inside. So right in front, if I stand like this, what's in front, the first thing is my bladder, okay? Right? If you're looking at this picture. The one thing that is behind my bladder is my womb, my uterus, okay? Then behind that, that's when you have your intestines, where you are digesting your food and all that. Do we understand this? So we understand that we have 3 openings, right? Do we know that we have 3 openings? The one where you do urine is not the same as the one you menstruate, is not the same as where you do your number 2, okay? All right. Going to the next slide, I just want to show you the 3 openings clearly. All right. So can you see that those openings are right next to each other, although they are different systems? So any tiny drop, even if it's less than a drop of water, goes into the wrong place, you can have an infection. Okay? So this is why, ladies, we must really take care of ourselves, because we are very prone to infections. So anything that comes from anywhere goes into the upper opening, you can have a bladder infection. Anything that comes from anywhere goes into your vagina there, you can have any discharge, any kind of infection. Same goes with each and every opening that is there. So that's why I was asking you, when do you go to pee after sex, the married women? And you said immediately. So don't wait. Because the moment you delay 2-3 minutes, something is getting into the wrong hole and it's going to give you an infection. All right. So this is how we get infections most of the time. I see a lot of women, they start fighting with their husbands and partners and asking, you gave me the infection. No, mommy, your hygiene is just not proper. Okay? Yes. So we need to exercise very good hygiene there to make sure that nothing slips into a different hole. Hence, I was asking, how many times do you bath a day? There is no limit to the number of times you bath a day. You need to maintain the hygiene down there. Hence, I was asking, when do you shave? And you say it depends with how the hair grows. No, there must be no hair there. Now you understand why we're supposed to bath and shave and clean that area. Because anything goes wrong there, you have discharges. Now you come running and say you want to clean. What do you want to clean? You just need to correct your hygiene first, okay? All right. Going on to the next slide. So like I was saying, that if anything goes into the wrong opening, you can have an infection. So the first infection we're going to talk about is a bladder infection. Okay? So let's say you are using public toilets. Don't sit on public toilets, okay? You rather squat in public toilets. But also make sure that it's clean for the next person. I tell people that your handbag must always have a sanitizer. Okay? Because you don't know where you are going to, you don't know the kind of hygiene that the toilet seats that you're going to be using. You must always have a sanitizer for the sake of yourself, not to catch these bladder infections. That's the first thing. And also, when you wipe, you must wipe front to back, right? So when you are sitting, you rather wipe, drop, and wipe from the back, drop again, because you end up with bladder infections, and most of you don't know. And the first thing you do when you have a bladder infection, you run to Clicks and they give you citrus soda. Okay? Now, I don't care what they tell you on the TV. I don't care what they are advertising as pharmaceutical companies. Do not use citrus soda. Do not use, no matter what flavor, cranberry, do not use it. Anything that changes the acidity of your urine, it simply makes the bacteria to grow more and give you further and more stubborn infections. So first thing to, if you are taking down your notes, please do not use citrus soda when you have a bladder infection. Okay. So how do you know that you have a bladder infection? You feel pain in your lower abdomen. Okay. So this is your lower abdomen. That area where that photograph is touching. So you feel pain in that area, right? And when you feel pain in that area, there is some pressure, as if you feel as if your abdomen is full. You are going to the toilet, you are peeing more often than usual. When you go to pee, it burns, and it's very irritating. And you go and you pee very little urine. That's when you know that this is a bladder infection. All right? Again, when you have those symptoms, don't say you want to clean your system. No, you have a bladder infection and it needs to be treated. So unfortunately, bladder infection, there's nothing over the counter. You need to go to the clinic. You need to go to a doctor. These days, there's even online consultations. You just explain exactly how you're feeling, and then they will send you a prescription online, okay, which is even cheaper than walking into a doctor. Clinics, they will just give you the antibiotics for free, okay? So next time you have a bladder infection, do not buy citrus soda, don't buy Eno, don't buy anything to clean your urine. There's nothing like that. You're just making yourself more prone to more stubborn infections, okay? Are we clear on the bladder infections? All right. Going on to the next slide. Right? That's just demonstrating how the normal discharge looks like. Remember, we say that it's supposed to be white or colorless, and it's supposed to be slimy. Okay? The moment it's watery or it's thick, right on the right side there, you see that it's thick. It's not slimy. It's thick, and it looks like a cottage cheese, right? Or a yogurt. Right. So many of us have this thick whitish discharge. It's called a yeast infection. We're going to go to the next slide. Have you ever seen your panties like that? Have we all seen somewhere, somehow, we have all come across something like that? Okay? Right. So it's a yeast infection. Not to say that you did anything wrong, not to say that you were naughty or something like that. That is a yeast infection. That is just a response to how your body is going through. You go through a certain stressful period at work, you can have this, okay? You have flu, you can have this, right? You were on medication for something, and then you end up with something like this. So this one is not a sexually transmitted infection. Every woman has it at any point in their life, and they need to just know how to manage it. Okay? So how do you know that you have a yeast infection? Firstly, you're going to see that thick white cottage-like discharge, right? And then you're going to feel burning or itching, right? Have we experienced that before? Yeah. And then what do you do then after that when you see that? Okay. Okay. So I'm going to give you 2 simple remedies that you can do without even going to the clinic. Number 1, you need to eat yogurt. Right? Not just any yogurt. If you go to Pick n Pay, that Live Well brand, you can eat that yogurt because it's got something that is protective over this kind of yeast infections. It's called, or you can buy what is called a probiotic. You can go to Clicks and buy something that is called a probiotic. Or you can buy this tube. It's written Canex V. Have you ever seen that tube? It comes with an applicator. So you put that cream, you put it in at night for 7 days. Okay? So if you're taking notes, take that down. So those 3 things, you need to have a yogurt with a probiotic, or you buy a probiotic, or you go to buy Canex V. If it doesn't clear within 5 days, then you can go to the clinic. Okay? Then we treat it with medication or anything else to upscale from that. Okay? The discolored discharges that we're talking about. So when you seek medical attention, when to go to say, because I'm having abnormal discharges. Number 1, when your discharge is green. Okay? Number 2, when your discharge is yellow. Right? When your discharge is brownish and it's foul smelling and it's not blood. Number 4, when your discharge is watery and it has a fishy smell, or when it's gray. So those are the instances, the only 4 instances that you go and say, I need medication because my discharge is discolored. And often this kind of discharges, they come with some pain down here. Okay? So these are oftenly most of the time sexually transmitted. Okay? Except for one, where it is gray, watery, and foul or fishy smelling. That one is not always sexually transmitted. That one is because of our hygiene. All right? Yes. It's because of our hygiene. I'm going to open up, I know there's so many questions. I'll open up a platform for the question and answers. But I just need you to take note of this. When must you get worried about your discharge or about your private parts or your genital area? When should you be worried? Okay? So when you have burning, when you have itchiness down there, you must be worried. When you have pain and it's not associated with a period, you must be worried. For our mothers who are already postmenopausal, meaning that you're no longer going for your periods, if you start to have pain down there, you must be worried. Okay? Obviously, we've spoken about the discharges when they change color. You must be worried when your discharge changes color, okay? When you are bleeding and it's not your period time, you must be worried. We have a lot of women that are on depot, okay? And then you find out you only see them at the clinic after 3 months and they say, I'm bleeding every day, or I have my periods every day. It's not a period. You are simply bleeding and it's not normal, okay? So any bleeding that is outside of your period time, or let me say any bleeding that is longer than 7 days, is not a normal bleeding, okay? So even if you're on depot and you are bleeding, it's not the end of the world. You still come, we stop the bleeding. We can even give you contraceptives on top of that depot just to control your hormones, okay? There are other women, I know the women from Zimbabwe, they prefer contraceptives from Zimbabwe, the oral contraceptives. Let me tell you, there is no difference, okay? A hormone is a hormone. There is no difference between the pills that you are buying from Zimbabwe and the pills that you can get here in South Africa. There is no difference. A hormone is a hormone, okay? And the misconception that the ones that you buy from home won't make you gain weight, but the ones that you buy here in Clicks will make you gain weight, that is a very, very, very wrong misconception, and people tend to believe that that is not true, Okay. And also, when you are postmenopausal, meaning that you're no longer going for your periods, right? Let's say you are 55 or 58 or 60 or 65, then you start bleeding. That's not normal. Don't think your periods are back. That's something very terribly wrong, and you must seek medical attention. You must just go to the clinic or to the hospital straight away. All right. So when else should you get worried when you see things going on down there? When you see any ulcers, okay? Any big pimples there or any abscess or boils, you must get worried. There you need to seek medical attention. Don't think that, it's just an ulcer, it will heal, it will go away. No, it's an indication that there's something terribly wrong with your health at this point. When must you get worried? Okay? When you see you've got discharge and you start to sweat, or you have chills, or you have fever, or you start to feel like you're cold, you're hot, you're cold, you're hot, and you have nausea. So nausea is when you feel like you want to vomit, but you are not vomiting. You must be worried. Okay? Especially if it's accompanied with any discharge or any pain down there. There, you must strictly just seek medical attention. Go to the clinic, go to the hospital. If you want to do those online consultations, you're welcome. But these are some of the instances that you should be worried when you see it happening to you. Okay. I'm going to talk about the two things. Number one, have you ever heard of pap smear? Okay. Pap smear is to screen for cervical cancer, okay? So what is a cervix? So you remember we spoke about the three systems. There's a bladder, there's a womb, and your intestines. So in your womb, that opening of the womb is what we call a cervix, okay? And women, especially black women in Africa, are prone to having what is called cervical cancer. So every woman, when must you have pap smear? So number one, your first pap smear is after your first sexual debut, right? So if your first sexual debut was at 25, meaning you must have your first pap smear at 25, okay? If it's normal, you must have your next pap smear at 30. If at 30 is normal, you must have your next pap smear at 40, okay? But the guidelines are different now. For those who have medical aid, you can have your pap smear and HPV testing every year, okay? Those who are taking treatment, let's say if you're on antiretrovirals, your ARVs and things like that, you must have a pap smear once every 3 years, okay? So, just by show of hands, how many women have had their pap smear done in the last 3 to 5 years? Okay. So we see that there's a huge gap. Okay. Pap smear is free for every woman in South Africa. You just need to go to your nearest center, nearest clinic, and they'll be very happy if you say, I'm just here to do a pap smear. Okay. We are not saying that there's anything wrong with you, but the earlier we catch these things, the better. And it's treatable, just by the way. The only time we're unable to treat it is when we find it and you're already coming, you have this water that is flowing out of your vagina every day, it's foul smelling, there's blood coming out, and then we diagnose you with let's say, like an end-stage cervical cancer. That's the only time that we can do nothing about it. But other than that, every woman needs to have a pap smear done. So before the end of this year, every woman must have a pap smear done, okay? Those who have had it over the past 3 years need to have a second. Or if you're on to your third pap smear, you must just get it done, okay? The last thing I'm going to speak about on my presentation is contraception. misconception about pills from across the border being different from pills from the side. A hormone is a hormone. Stop you from taking any contraception because of that. So contraception, there's so many things. It's not the end of the world. If you take a Depo, it's making you bleed. You move on to the next. If you take Depo, it's making you gain weight. You move on to a 2-month injection. So the 2-month injection will not make you gain weight if you're gaining weight on the Depo, right? There's also so many options like loops that can be inserted for 3 to 5 years. So contraception is really, really a part of women, and we must always make it a point that to say that if I need to be on contraception, then I need to be on the right one, then I need to be on one that makes me comfortable. So there's so many women that come and they are bleeding on contraception. Again, I'll repeat, you are not supposed to bleed for more than 7 days. Whether you're on a contraception or you're not on a contraception, you really need to seek medical attention if you're going to bleed for more than 7 days. Okay. The one last thing I want to speak about, okay, there is a trend that we are seeing in black women. Bleaching. Bleaching. People are bleaching, and it's not for black skin, just by the way. It's not for our African skin, because there's too much sun in Africa and you're only damaging your cells, okay? So those who are thinking of bleaching, please don't go down that path, okay? I'm going to open up a platform for questions, and then I'll answer the questions. Okay.
I want to find out if you've had a total hysterectomy and you sometimes feel that there is something happening down there. Do you have to take medication, some form of medication, or do you still have to continue with your hormones? And how long must you take the hormones?
Okay, I'm going to answer that one. That sounds like a very, very individualistic thing, okay? So when you've had a total abdominal hysterectomy, it simply means that your womb or your whole uterus was taken out because you had fibroids, or you were bleeding, or you gave birth and you were bleeding uncontrollably and they had to take out your womb, right? So the moment you start to feel like there's something going on down there, the first thing is to seek medical attention. You need to have a scan to see, is anything growing? Did they leave any ovaries behind? Is there any cyst that is growing on in there? So that is very individualized, and you need to have a scan. Okay? You don't stop your medication, you don't stop your hormones, you just need to have a scan to make sure that everything is still intact.
So after doing the hysterectomy, the hormonal pills, you must continue with them until...
Okay, again, like I said, that is a very individualized case. I think I can see you. Let me attend to your case because it's very individualistic. Okay.
Thank you.
All right.
Good afternoon, Doctor. I would like to ask, I heard from the contraceptive side you were talking more of the bleeding, like it has to be not more than 7 days. How about maybe you're not bleeding, like now you no longer have your regular periods, or maybe it's just maybe after 2-3 months then you have, or nothing at all. Is it normal, or you will need to do something about it? And also another question is, we were talking about taking care of our downward there. I want to ask if you can help us, because sometimes the itchiness is not about any sickness or whatsoever, but the way we are shaving. what can we use to help us to avoid ingrowns in that itchiness?
Okay, so there's two questions here. Number one, it's about the bleeding while you're on a contraceptive or not bleeding at all. Okay, so let me put it across. Most contraceptives, you will not have your periods or you will not see your periods. Okay, that is normal because of the mechanism of action of a contraception. So some of them, they stop you from ovulating. So if you don't ovulate, you are not going to see your period, okay? So some people, when they start depo, they are not going to see their period for the longest time, or even 10 years, they won't see their period because they are on a certain mode of contraceptive. But if you're on a contraceptive and you are bleeding for more than 7 days, that's where the problem is. You are not supposed to bleed for more than 7 days when you're on a contraceptive. Did I answer the first question? Okay. Going on to the second question, again, it's individualistic in the sense that there are different modes of shaving. Some prefer to do the waxing. Some people do threading. Some people use shaving sticks. Some people use hair removers, okay? So if you're going to use a shaving stick, you rather do it, you put a little bit of soap and a little bit of water. Don't do your shaving while your skin is dry. That's when you have itching. So you must put a little bit of a little bit of soap and water, and you make it a little bit foamy in your armpits or in your private area. Then you can shave off with a shaving stick. The moment you shave on a dry skin, you are going to experience itchiness. Did I answer the second question? Okay.
Afternoon, doctor. My question is a simple one. We sometimes we are forced by the medical aid to take a policy on cancer, and they are forcing us to do pap smear every year. Is it legal?
Okay. The legality part, that I will leave for the lawyers. But I will tell you the guideline from the National Department of Health. Okay. So the National Department of Health, if you are HIV positive, they say that it's once every 3 years. Okay. If you are HIV negative, it says at 30, if it's normal, the next is at 40. Okay. At 40, if it's normal, the next is at 50. Unless there's any other medical condition that arises, such as abnormal vaginal bleeding. Okay. When it comes to the private sector, it's a different ball game altogether. Number one, it's a game of money, okay? Because now they are going to claim all these procedures from you. Number two, you are definitely going to be forced, but if you are not comfortable as well, you put it across to them that it's my right, I'm not comfortable, and the National Department of Health guidelines says this, and my previous pap smear was normal. So you are allowed to decline because the National Department of Health is saying a different thing. Okay. Did I answer the question?
I also have a question.
Yes.
I want to find out, is it okay to take cranberry tablets for the baby? The vagina.
Okay. All right. So, I'll give you my answer from a medical perspective, not from a pharmaceutical company trying to push sales, okay? I believe in the things that work naturally. Okay. I would say instead of taking cranberry tablets, because you're simply taking flavor into your body. Okay. You want that flavor. Are we on the same page? You want that freshness, you want that flavor. All right? I'll tell you what is better for that flavor. Okay? Eating fruits, tropical fruits and citrus fruits. When I say citrus fruits, I mean your, I'll bunch them all together. Pineapples, oranges, naches, grapes, strawberries, blueberries, cranberries, or cranberry juice itself, okay? Or orange juice itself. Some of the fruits that I've taken down is like watermelon, which is also good because it gives that freshness, which takes us back to when we started, when we said, ladies, what do you eat at night? Because if you're going to eat pap and a very heavy meal, you are not going to have that freshness that you are looking for. And you are not going to have that flavor that you are looking for. But if you eat a little bit of fruit later, let's say a pineapple, a few grapes, a few strawberries, an orange or something like that, then you're going to have that freshness that you're looking for. You might not even need to buy those cranberry tablets because I know they are very expensive. Just buy the cranberry juice or the apple juice or the grape juice and drink it instead.
Good afternoon, doctor. I have a sister, she was bleeding like abnormal, and then she was admitted. At the hospital, they told her that her genes, she's having male genes. That's why she was bleeding that way. So they gave her some tablets. So since then, since she started to take those tablets, she's not like bleeding or even seeing her periods. So she's now sort of worried, like, what is going on? So what is she supposed to do?
Okay. That case is different in the sense that we are talking about a different genetic makeup. You understand? So again, through Mama, I'll attend to that case individually because it's quite sensitive. I really can't discuss because of the genetic makeup. Because if I am to give you the answers right now, it's a breach of privacy a little bit. So just come through, Mama. I'll attend to your case individually. Okay.
Thank you.
All right.
Good day, doctor. Good day, everyone. Doctor, I want to ask, how do we wash or clean our Betty? Our Betty? Okay. Yes. How do we wash or clean our Betty? Do you know the reason why I'm asking is some of us who use our finger cleaning inside. So is it healthy? That's why I'm asking.
Okay, all right. Firstly, let's go back to the principle, right? We said outside it's soap, inside is water. Okay, so if you're going to use a towel that you are using to bath, to clean inside, do you think it's 100% water? Right. So we use our hands to wash inside because we just need to introduce water only. Okay?
Yes.
All right.
Afternoon, everyone. I just want to ask a question because I was a little bit shocked about it. After giving birth, remember there's that centimeters and coming together. When is the right time to get to intercourse? Because I think other people, they wait for 3 months. Is there a reason for 3 months? If it's 2, is there a reason? And then the second question that I have, it is that a person who goes to their menstrual
period, but every time when they finish them, they feel the itchiness. Obviously, when they feel the itchiness, they scratch it, and then it becomes like a blister or it shows some scratches. But it happens only after they come out of their periods.
Okay, so to answer the first question, the period of time medically that you are allowed to only have sex after giving birth is 6 weeks, okay? So 6 weeks is a time that we called postpartum period. That's when your womb is contracting, your hormones are going back to normal, your tissues are retaining their elasticity. So the period medically is 6 months. Cultures have different things, but on the medical perspective, it's 6 weeks. Okay? To answer the second question, right? This is what is called a yeast infection, complicated yeast infection. Because that kind of yeast, you are not going to see it on your panty. But it goes into your womb, then it goes and lines the lining in your womb. So much that every time you go on your period, you are left with that itchiness. Okay? So if you're somebody who is like that, you need to go and get medication, either from pharmacy or from the clinic or from a GP or anywhere, because you are the right patient who is supposed to take medication during your menses to take away that yeast infection. So there's also a yeast infection that comes off like that. Those are very silent and very complicated. Okay? So if you are having that kind of a problem, again through Mama, I'll be able to assist you. So if you feel like every time after your period you itch, that is still a yeast infection. And that kind of yeast infection, we treat it with tablets. Okay. Do we still have any more questions? Okay, the last question.
Doctor, my other question is on PrEP. PrEP, the one they say that you have to take so that maybe when you get into intercourse with the person, can you educate, especially me, I don't know others, but for me, what are the pros and cons of it? Like, how does it work, and which one would you advise, the pill ones or the injected one, and for how long should we take it?
Okay, all right. Very, very, very important question. Okay, so I'll just take a moment to explain. So she's asking about PrEP, which is basically pre-exposure prophylaxis. The tablets that you take to prevent HIV. Okay? So firstly, PrEP in South Africa is free for everyone. And everyone is allowed to have PrEP. Everyone is allowed to have that right to say, I want to prevent myself from getting HIV, so I'm going to take a tablet every day. It's not an ARV. It's a tablet that prevents you from getting HIV. Okay. So the best PrEP on the market right now is a tablet that is called Truvada. If you want to take that down, Truvada. Right? So there is a notion also these days that married women, when you go to the clinic, all the nurses are saying, do you want to start PrEP? Do you want to start PrEP? It's up to you. Basically, it's really up to you. There's no law holding you against from taking PrEP. Like you see, there is a question about PrEP. PrEP is on demand. Anyone is free to get that medication that prevents them from catching the HIV virus. So the best PrEP on the market, the one that has 99% right now, is Truvada. It's the tablets. The injections, they are still on trial. So there's a 2-month injection. That one is still on trial. Studies are still continuing. There's a new injection that's coming once every 6 months. It's called lenacapavir. It's still on trial as well. So the best PrEP on the market is Truvada, which is the tablet. Okay. I think in the absence of questions, should I? Okay.
How do we get it and resulting in the cause, the cancer?
All right. So HPV virus is the virus that causes cervical cancer. So to start off, there are about 200 types of HPV virus. But there's two that we're mainly concerned about, which is HPV virus number 16 and number 18. So any sexually active woman or any woman who's been sexually active in their life can get this HPV virus. This is why we are saying you need to have a pap smear frequently, once every 3 years, because no one is free from the HPV virus. It simply just happens. And for more especially for women who are taking ARVs, even we need to even be more precautious because it tends to be more prominent in that type of population. So HPV now, there's a new development. Any woman can be vaccinated against HPV. Okay? But here's the catch. If you want to do it by yourself, it's quite expensive, right? If you're on medical aid will pay for you, but it's about 2,900 rands an injection. So I am encouraging every woman to go wherever they are offering free pap smear testing. Please just go there. They will test you. They will do your pap smear and HPV. And if it comes back with any of the HPV viruses, you then get a free vaccination against HPV. Okay. Are you answered, Mom? Yes. Thank you. If you have medical aid, please go. Just go and have a pap smear and HPV testing. If they find any of the HPVs, they will vaccinate you against it. And also, women, there's programs in the schools. They are vaccinating our children against HPV. Please, don't say no. Don't tell your child when they are vaccinating others, please say no. Or don't refuse to give consent, because it's going to help them in the long run. You'll be long gone. You'll be dead when they are 60, 65, struggling on their own now. Okay? So let our young girls and children have this free HPV vaccination in schools. Do I have any more questions?
Yes.
Okay.
Sorry, I think they are shy to ask.
Okay.
But it's something that a few ladies have constantly been saying, Mama, what causes, towards the end of your period, maybe it doesn't happen to other ladies, but there's just this foul smell. No matter how much you bath, you try to, but it doesn't go out, and it's so horrible. Is it normal? It's part of the period, or there's something we can do to rectify it?
Okay. So I'll answer in two parts. Usually, you would be experiencing discharges that you are ignoring. That's the first thing. You are experiencing discharges that you are ignoring and you are not paying attention to. So by the end of your period, it's mixed with blood. So it's very foul smelling. That's the first part. I'll answer it. The second part is clotted blood sometimes can smell very badly to a person. Okay? The way blood smells to me and the way blood smells to you is very different. To me, it smells like water. I don't even smell that smell because I'm so used to it. So sometimes your clotted blood, because your blood is clotting at the end of your period, so it smells very badly. The smell is different from fresh blood. So sometimes you might not be able to stand your own smell of clotted blood. So that's the two ways. So it's either you're ignoring discharges and now at the end of your period it mixes with blood, it becomes worse, or you just can't stand the smell of clotted blood. Last question.
Good day, everyone. Good day, ma'am. I wanted to ask, because I'm concerned, I wanted to understand if this kind of a thing is normal. Because it's like to others it doesn't happen. Like maybe when a lady is during in their period, and that time of period, you be feeling very cold to an extent that you would just see that if you don't dress, for example, maybe if you don't put a leg in, even if it's maybe for 2 minutes, it's like just you not covering you almost everywhere like that, even wearing a legging or wearing something that, that can give you that, that's warm. And then it happens that the more, when you're not dressing warm clothes, even if it's summer or any season, it happens that the pains, they increase while you are in a period. And if you wear warm, it goes down. So when asking others, it's like others, they don't experience that. So I wanted to understand if it's normal.
Okay. So first thing, you have iron deficiency, okay? You don't have enough iron in your body. So you feel more cold than an average person, okay? Which takes us to a part where, as women, we lose blood every month. And we don't eat enough because we are trying to maintain our figures and all that. So you must always take multivitamins and iron supplements every day. It's not only during pregnancy that you must take iron supplements. You must also take iron supplements even when you're not pregnant and out of pregnancy period, because that's when you start to feel colder than an average person. It is iron deficiency. You're losing a lot of blood that you're not replacing, either with your diet. You're not eating enough red meat, enough spinach, enough livers, enough vitamin C. So you will tend to feel more colder than an average individual. So we need to correct your iron deficiency. In the absence of more questions, thank you so much. I will see Mama and the other two ladies. Yes. Thank you.
Thank you so much, Dr. T. We thank you so much. You know, in other setups, people would pay for this information. But we are so blessed that we have this information at our disposal, and we have learned so much. For us to be here, it's such a blessing. Thank you so much. Thank you to everyone who has contributed to this successful day. Amen. We have unfortunately come to the end of our conference. Hallelujah. A successful conference. Hallelujah. Amen. So